Hi guys. So I'm currently in Georgia, the Republic of Georgia. It is in Eurasia. I'm getting phage therapy done. I'm just going to give you a quick rundown of what I've been doing so far. It's only day 4, but okay. So phage therapy is interesting to say the least, but the main reason I'm here is because the Schumacher protocol, you're supposed to get rid of Marcons, which is a staph infection or staph bacteria, not infection, in your sinuses. And I haven't been able to get rid of it because mine's a stubborn bitch. So I'm here trying phage therapy to get rid of my Marcons. So the first thing you do for phage therapy is you send a swab in. They check the bacteria and they see if they have a phage for it. And if they don't have a phage for it, they can try to make one. And that's what happened with mine. They try to customize one. So they made it, they created it, and then I had to wait a few months for whatever reason. And then I flew here, and now I'm staying in an Airbnb, and I'm ready for the phage therapy. So as soon as I got here, the driver who also works for the clinic, Marco, he was adorable. He gave me the thing, the urine thing, specimen thing, and urine and fecal. So it was kind of gross trying to translate that from him. But so I handed that in the next day. Other people here, there's a woman from South Africa and 2 women from England. They said that they sent theirs in before they even got to the clinic. So I don't know how that happened and why mine didn't go, but I don't know if you can't send it from the US or I don't know, but no one told me about it. So I had to do it the day that I got here. So I did it, and then I brought it into the clinic the next day. And I haven't gotten my results back yet, but just letting you know what the rundown is for that. Yeah, so the first day I went in, they did some sort of weird hand test, and they checked you out, and they ask you some personal questions, and then Natalie, super cool, she translates everything, and everyone there is super nice and really caring, really sweet, nothing like we have in the US where you have to scream at them to get anything done and they don't care about you at all. So they're pretty caring. And so after the hand test, they put me on IV. They put you on IV pretty fast. So the IV they gave me was potassium, sodium, calcium, vitamin C, B complex the first day, and then they add some sort of Russian blood cleaner. I don't understand what it is. Everyone there, we all try to figure out what it is. If you Googled it, we couldn't find anything on this Russian blood cleaner, but I have the official name of it if you're interested, and I'll put a picture after this part. So it goes from vitamins and minerals, day 1. Then they up it with the Russian blood cleaner. And then eventually, after you start phage therapy, they put you on an anti-candida drip, which was kind of confusing because I was under the impression that phages don't wipe out your bacteria to the point of giving you candida, but maybe they're giving it for a different reason. Not entirely sure why they do that, but we're all on it, so we're all in the same boat. I'm going to put a clip of the IV list right here. Next, I want to talk about the inhalation phages. So this you inhale them through your nose and your mouth. And this is what the box looks like. It's in Georgian. Here is, I think that's English. Yeah, so actually let me get you this. So this is the bottle it comes in. Great camera. I don't know why it's doing that, but you get the point. So it comes in a bottle like that. And what you do is you take a needle, you fill it up 2 milliliters. Yeah, 2 milliliters. Okay, sorry, my alarm went off. So you fill it up 2 milliliters and you put it inside a inhalation device. It's actually a nebulizer. Sorry, I'm just using their terminology. It's a nebulizer. This one I can't really, I would have to get a converter if I'm going to use it in the US. So just keep that in mind if you're traveling or whatever, because this one has the European plug. Yeah, so that's for the inhalation phages. I'm going to show you a video of me inhaling some phages. Next, what they do is they put you on a regimen of probiotics, and it's pro and prebiotics, which apparently Georgians are really good at. So they have access to certain ones that we don't have in the US. So here is one of them. It's a probiotic and prebiotic. Some more illegible stuff. They put you on an enzyme for food. So they're fixing a lot of gut issues, which is pretty cool, considering that's not really why I'm here, but that's pretty cool that they do that. 2 for 1. And they also put you on intestinal phages. So these are disgusting, like for real, disgusting. We all joke about it in the clinic. We're like, yeah, it definitely tastes like shit. So this is what it looks like. Okay, well, it doesn't like it, but basically just says phages in Georgian. So I have to gargle that because I have some sort of strep living in my throat. So I gargle it and then I swallow it. Take 2 of those. What else? Phages. So the first time you inhale the phages, they do it in the clinic. But then you buy that machine that I just showed you, and you can do it yourself. So I'm gonna show you a video of me, just a quick video of me inhaling some phages. So after the first day, I met with a doctor who did some postural manipulation on me. She really got in there. It was gross. She would like dig her fingers in and like pop you around, and it was pretty good for me because my spine isn't aligned. And when she was done having her way with me, she aligned my spine, so that was pretty cool. My hips didn't pop out, which is rare for me. So it was pretty good for being manhandled, you know. She's legit. Then after that day, we were taken to an otolaryngologist. It's like an ear, nose, and throat person, except they're for surgery and other stuff. So he looked at my deviated septum, which is my broken ass nose right here. And he was like, oh, you need surgery, blah, blah, blah. And I was like, definitely not. Like, no. I don't have any issues breathing, and mucus still comes out of both nostrils. So I'm not gonna mess with that. I'm not here for surgery. In fact, that's why I chose phage therapy, because I didn't want nasal surgery, because I have this bacteria living in my nasal passages. I don't want to just do surgery on it. I'd rather get rid of the bacteria first. If I can't, then maybe I'll consider surgery. But he said, he said it was up to me. It's cheaper in Georgia, obviously. So I will take him up on that offer if I feel it's necessary. But for now, I'm just letting him do his thing with nasal irrigation. So what they do is they lay you down, they shove this thing up your nose, they clean out your sinuses, and there's this lady, the nurse or doctor lady, and she makes you do this cuckoo noise, super weird, and she's like, cuckoo, cuckoo. So now it's like this running joke between all the patients that we cuckoo. I don't know why she does that. I think it stops the fluid from going down your throat, but I'm not really sure. But anyway, so they hook you up, they clear out your sinuses, it comes in this way, and they vacuum out, basically, out the other end. They clear it out, and then they do it again, but with phages. So now the phages are in there, and I think, honestly, that's what I came for. They said that they had a machine that did this, and I didn't know of any machine that does this in the US or any doctor that works with phages, probably because it's illegal. But anyway, so yeah, so he does that, blah, blah, blah. So now every day we go to the hospital and we get our nasal passages cleansed, vacuum cleaned. I'm trying to think. I think that's pretty much all I have for you guys now. After 2 days of that, a bunch of biofilm came out of my nose, like just gel upon gel, which is disgusting, but super cool because that's what I came here for. So hopefully it was worth the trip. And because of the IV vitamins and minerals, my face is kind of shrank and my eyes have cleared up. I don't know if you can see, but not too excited about that because I don't care about that. I look better, but I'm here for fatigue and all kinds of other things, not for face shrinking and eyes being bluer. That's everything I can think of, but this is just part 1 of phage therapy, and I'll continue to let you know my progress. Thanks, bye!